Hello, we're going to be doing the head, neck, and lymphatics assessment for today. So first I will go ahead and this is my patient here. I'm going to introduce myself to the patient. Hi, my name is Meredith and I will be your nurse for today. Can I go ahead and have your name and date of birth?
Catherine Garcia, January 1st, 1965.
Okay, perfect. I have the right patient. I am now going to go close the door for privacy. And next I'm going to go wash my hands. Next, I am going to gather my equipment, which is the stethoscope. This has been cleaned and sterilized for this assessment. I'm going to go ahead and explain the procedure and get consent from my patient. Hi, we are going to be conducting the head, neck, and lymphatics assessment today. Do I have your consent to go ahead? Okay, perfect. Let's get started. First, I'm going to be inspecting the head and skull area. I am inspecting for its size, its shape, if it's an appropriate shape for this patient's body. This skull would be characterized as normal cephalic, which is a normal head shape for this body. I'm also inspecting the facial features for their symmetry. I'm inspecting the facial expression. Can you go ahead and smile for me? Okay, good. Can you go ahead and frown? Okay, good. The facial expression seems symmetrical and normal. Her eyebrows are symmetrical, the face, the smile. There are no involuntary movements or tics. There's no swelling, no edema, no lesions upon inspection. So everything looks good there. Next, I will go ahead and palpate the skull area, the skull and head area. I am palpating for any swelling, lesions, masses, anything that may seem abnormal. Okay, I feel nothing abnormal, no lumps. Everything feels normal. I'm going to go ahead and palpate the temporal artery along her temples here. I feel a slight pulsation, which is normal. Everything feels fine. Next, I will palpate her temporal mandibular joint, which is your jaw. Can you go ahead and open and close your jaw for me? Okay, good. No clicks. I feel nothing abnormal. Everything feels normal there. I'm also going to go ahead and take a look at her neck area for its symmetry. No lumps, no swelling, no edema. Everything looks normal. Trachea is midline. I'm next going to be testing her neck, her range of motion, and any resistance that may be apparent. Can you go ahead and look to your left? Can you go ahead and look to your right? Can you go ahead and place your ear to your shoulder here, your other ear to your other shoulder? Any pain, any resistance?
No.
Good. Her range of motion is good. Everything seems normal there. Next I'm going to go ahead and assess her lymph nodes. The lymph nodes are located all around the face area and go all the way down to her collarbone. First, the periauricular lymph nodes here are in front of the ear, and then the posterior auricular lymph nodes behind the ear, and then your occipital lymph nodes here deep behind the head. Everything feels normal. I do not feel any lumps, no hardness, no swelling, so that is good. Next, I will palpate her jugulodigastric lymph node, which is right here where her jaw is, the bony prominence. No swelling. Your submental, and then submandibular lymph node under the mandible here. No swelling. I cannot feel no palpable lymph nodes, so that's good. Next, her cervical lymph nodes. Your superficial cervical lymph nodes here in front, and then behind your posterior cervical lymph nodes. Then if I palpate a little deeper, I am palpating for her deep cervical chain, which these run all the way down to her collarbone here. So I do not feel any swelling, I feel no lumps, everything feels normal. And then your supraclavicular lymph nodes here are all along the collarbone. I do not feel any lumps, nothing abnormal, everything looks good there. Next, I will palpate her her glands. You have 3 major glands in the face area. Your parotid glands here where your cheeks are. Good. Any pain? When I palpate, do you feel any pain, any tenderness? Good.
No.
Your sublingual lymph nodes right here under the tongue, and then your submandibular glands. Your submandibular glands and sublingual glands are right here. Your submandibular glands under the mandible. Everything feels good, no swelling, no lumps. Everything feels normal there. Next, I will go ahead and palpate her trachea, your trachea here. I am inspecting and palpating to see if it is midline. I see there is no abnormalities there, no bulging, no swelling. Everything looks good. And then I'm also palpating for her thyroid gland. I'm going to go ahead and stand from the behind, and I'm going to palpate to see if I can feel her thyroid gland. Can you go ahead and tilt your head forward and slightly to the right? Good. Okay, go ahead and swallow for me. Okay, I do not feel anything, no lumps. Can you go ahead and tilt your head to the left? Swallow for me, please. Okay, her thyroid gland is not palpable, which is a good sign. I do not feel anything abnormal. Now I'm going to go ahead and auscultate her thyroid for any bruits using the bell of the stethoscope. Even though I cannot palpate the thyroid gland, it is important to auscultate for any abnormal sounds such as a bruit. Okay, I do not hear anything abnormal. I do not hear any signs of bruits, which is good. Everything looks good and sounds good and feels good. So that will pretty much conclude the assessment for today.